Has anybody made a case or even made a guess as to what the difference would be in terms of the number of drug-related deaths in Glasgow between proceeding as we are or bringing in a supervised drug consumption facilities?
There are two useful studies in that regard, one from Vancouver and one from Sydney. What the Vancouver study, which is probably the most robust one in terms of measuring outcomes in drug-related deaths, showed was that in the near vicinity of a drug consumption room, which in Vancouver is cited very much around where public injecting was highly localised, they found very significant reductions in numbers of drug-related deaths. The Sydney study showed that there were very significant reductions in ambulance call-outs for overdoses around the site of the medically supervised injecting centre in Sydney. So the translating that evidence into Glasgow would suggest that because we have the highest risk population really in the city centre involved in injecting drug use, that there is likely to be a benefit in terms of reducing their mortality rates if they utilise a drug consumption room, and the impact of that would be on that cohort.
Is there any evidence to suggest that drug consumption rooms don't work, that they do have adverse impacts and that they do cause societal harm?
Not that I've come across in the research and the reading
I've
done.
Nothing that you could point to at all that shows that they have any sort of negative features?
I think one key factor is working with the local community, so residents and businesses, to build a relationship there. And we see in the data that because, as I said, they're located in areas of difficulty, residents do favour it. And I think some of the perceptions around that, the broader perceptions, is maybe where we need to continue to do work. But in terms of health data and hard facts of harms.
So how do we get this evidence across to UK government? I mean, what do we... I mean, we saw the Home Secretary's response, which was because of what he experienced as a child, he was prepared to dispense with all evidence, with all the things that you tell us about having positive impacts, about how this could save lives. It was all to do with what he saw. How do we start to impress upon those that are the gatekeepers to this, that this is important, this is important stuff?
We've noted that in the response from the Home Office to our proposals and to communication with police and drug commissioners, that's been made public as well. The Home Office has actually acknowledged the evidence base around drug consumption rooms. So the Advisory Council on Misuse of Drugs, which is the government's own advisory committee, has made a recommendation to pilot it. Government's own reports have shown the potential benefit of this, and the government has also acknowledged the EMCDDA evidence. So it's not a question of need to convince around the evidence base.
Just very quickly, maybe on the issue of the Home Secretary, as you asked very specifically, I think his experience as a child, I obviously don't know the circumstances, and they're clearly completely valid, I'm sure. But what we have to think about is what's the situation now, and I wonder whether actually visiting the sites in Glasgow where we see public injecting and where we see the drug litter in the middle of the city centre, whether that actually... from the research evidence where we see that these facilities do respond to those needs, maybe one further mechanism. As Saket's described, we know that the Home Office has acknowledged the evidence of effectiveness, and it's really about we in Scotland want, within our local context, to pilot this service, and there's good reason for that, and perhaps witnessing the realities of that could be a further means to try and convince the Home Secretary.